Hi, it's Dr. Renee with blackdoctor.org, and here we are with another medical minute. So, in case you didn't know, March is Colorectal Awareness Month. So, I know some people are like, what is that? But you will learn today. Do me a huge favor, share the broadcast. I don't care what platform you're watching on, sharing is caring. So, please share the broadcast. And of course, as always, type in the chat and let us know where you're watching from. And I think that's all of our housekeeping. So I will introduce our guest. So today we are chatting with Dr. Janice Fields. Thank you for joining us.
Thank you so much for having me.
So, you guys, I will tell you a fun fact. Dr. Fields is who performed my first and only colonoscopy. And I have talked about it on here after I've talked about it many times. And I've explained to people it really was not that big of a deal. So we'll get into that later. But can we please first talk about what does colorectal mean? Because I'm sure that blew some people's minds and they're like, what?
Well, thank you, Dr. Renee. Colorectal cancer is, and as Dr. Renee said, March is Colorectal Cancer Awareness Month. So colorectal cancer, unfortunately, is taking more and more of us and has been affecting all of our communities for a really, really long time. It is the third most common cancer in the United States and the second most common cause of cancer deaths in the United States. So this is such an important topic. And we're actually seeing colon cancer rates going down in the older population, but it's rising in people under the age of 50. Especially Black and brown individuals. And so I think this is such an important topic, and I really want to get the news out there that 45 is the new 50. You may have heard that you should get your colonoscopies around age 50. Well, now it is 45. It's been 45 for Black and brown folks for a long time, but now it's 45 for everyone.
So quickly, can you please tell everyone what kind of doctor are you? What is your specialty?
I'm a board certified gastroenterologist. That means I deal with folks with digestive problems, everything from acid reflux, some gallbladder problems, liver problems, colon problems, digestion, of course, constipation, diarrhea, and I screen people for acid reflux, colon cancer in particular. So I do a lot.
So that tells you right there, that's the kind of doctor that you need to go to, because that'll be the next question. Okay, so I need to have this test now. What doctor do I go to? So that's the kind of doctor you need to go to. Do you have any thoughts on maybe why we're seeing colorectal cancer in younger people?
So, there are a lot of theories out there. Some have looked at better access to screening and getting information out. There's always that talk about, food substances, you are what you eat. Are we changing things in our diet? We process a lot of foods, and so there's probably something to that, and just the genetic changes that are occurring. The longer humans are on this earth. So we really do not know the answer to that right now.
But yeah, I mean, it just look at our lovely Black Panther. Yeah. Chadwick Boseman, he died at 43, but he must have had it for
correct
a couple years. So
he was diagnosed at 39, and unfortunately, he would not have met any of our, recommendations for an average risk individual. He wasn't old enough to have average risk screening. Now, unfortunately, once he had symptoms, and we can get into that later, of typical symptoms, by then his cancer, unfortunately, was already, too far for curing. So that's the importance of screening if you don't have any problems. And if you do have problems, to talk to your doctor. My threshold has gotten, over time, it's gotten lower and lower to whom I offer colonoscopies. And I have a really zero threshold, to be honest with you, because you just never know. You just never know.
Yeah. So the one thing I want to talk about before we get into the symptoms is how can we prevent it from happening?
So I wish I had an easy answer for that, just because the average colon cancer, that individual may not have family members, may not have any diseases that might predispose them to getting colon cancer. And so it's just being vigilant about your health. And if you notice any symptoms, to go and talk to your doctor about it. For the record, reducing cancer in general can come from maintaining a healthy weight, eating a variety of foods that have, antioxidants in it. So the brightly colored foods that are out there, eating whole grains, eating foods that digest more slowly, a more plant-based diet. Not to say that, some meat is bad for you, but in general, plant-based diet, I think most humans were supposed to maintain. And, having regular checkups, just exercise and hydrating and doing things to reducing stress and getting more sleep.
March is also Sleep Awareness Month, and apparently last week was Sleep Awareness Week, but we're going to be talking about sleep later this month because
Right.
I think people don't realize how important that is. It's very important. And also, isn't fiber very important to the colon?
Fiber is very important. Yep. So those whole grains, more plants, the fiber, it's digested. It helps to eliminate waste and who knows what else, but it, can help with a whole lot of things, maintaining healthy blood sugar, maybe reducing your cardiac risk. So those are all just, things they may tie in together, reducing cancers in general. We think more fiber can play a role with.
So I tell everyone I drink a gallon of water a day, but in my water I have a fiber supplement. They're not paying me, so we're not going to tell them. But I put that in there, and then I just started doing the gummies.
Oh yeah,
gummies that also are fiber because I just feel like I do try to eat my vegetables every day, but because of the way that I eat, I don't necessarily eat as many meals as everyone else. So therefore, I don't think I'm getting in as much vegetables as everyone else. So that's why I make sure I get my fiber.
Yep. I tell my patients too to sneak it in where you can, make substitutions for higher fiber, varieties of foods that you're already eating. That way you're still enjoying what you were enjoying already, but just choose the higher fiber version of that and getting their fiber conveniently. If it's a tablet or capsule or chewable gummy, pick the one that's going to work for you.
Yeah. So we've talked about prevention, everyone. Please, we say it all the time, but you need to eat a healthy diet. You need to exercise, all the things. And then my favorite thing is you need to go to the doctor regularly. COVID really introduced us to the fact that many people in our community don't have a doctor. They use the urgent care as their doctor, and that's not a primary care doctor. That's the urgent care. Or you use the ER. Neither of these is a good idea. You need to have a primary care physician who can keep track of what's going on with you on a regular basis so that just in case something does change, they'll recognize it if you don't. So what signs and symptoms would you say that somebody should look for, or if they've seen these things, they might need to go see a GI doctor?
So, a lot of people, unfortunately, I diagnosed a lot of people with colon cancer who did not have any symptoms. That being said, a lot of symptoms of colon cancer can also be symptoms of benign things. So the important thing is if you have something that doesn't seem right, go talk to someone about it. And it may include, diagnostic testing, including a colonoscopy or x-rays or CAT scans. So the most common symptoms, though, that we might see are a change in your stools. If you were, miss regularity once a day and all of a sudden you can't go, there's some change. Now there might be a non-cancer reason for that, but you definitely want to get it checked out and include that, in something you're going to look for. Seeing blood in your stool. Now there are a lot of things, again, that are benign that can cause blood in the stool, but if I see someone, that's one of my triggers, for until otherwise, I don't have x-ray vision. We can't predict the future. So colonoscopy is usually going to be in your future if you have bleeding, from your rectum. So you go to the bathroom, have a BM. If there's red there and you're not sure, check it out. New abdominal pain that doesn't go away, maybe it kind of comes and goes, but weight loss as well. And then more advanced cases, your stomach might actually be bloated or distended. You might feel sick or nauseated and those types of things too. So any new symptom that you have, if you're not sure about it, just no question is a bad question to talk to your doctor about.
Yeah, make an appointment and get it checked out. You'll sleep a lot better when it was nothing. Or if it's something, the earlier you find things out,
right,
the better it is to treat them. So I know everyone has seen the commercials of the people skipping around in the Cologuard commercials. And I personally have told several people, okay, go on and get the Cologuard if you want to. But if something comes up on it, you're going to have a colonoscopy anyway. So you might as well just go on and have the colonoscopy. But what is your take on that?
So I feel similarly, and perhaps I'm biased because I do colonoscopies, but of course, a colonoscopy is going to be the most accurate
Mm-hmm.
in both detecting as well as being slightly more preventative. The Cologuard picks up abnormal cells, and I look at that to say that that might be an early cancer or an advanced polyp. Well, a colonoscopy can pick up a lot of polyps before they reach even that stage. So I think there's some benefits to that. Now, I don't hate on people who want to do a Cologuard because I do give them that disclaimer as well, that if it's abnormal, then you need to follow it up with a colonoscopy. And I also make sure that they're not substituting a Cologuard when really they should be having a colonoscopy. If you want the small chance that it's a false negative and you really have something, if you have a history of polyps or a family history of colon cancer, or you really were having some symptoms that should be checked out. So no screen or any screening is better than no screening, but there's still that caveat in there. And so I think just, with some education at how to use it, that it's okay for people to do it. And then, we have a new test that has just come out, a blood test that is similarly yoked sort of to the Cologuard, and that is to detect the suspicion of a cancer. Now, the goal is to get it as early as possible, but we really have no way to know how early it's going to be, if it's abnormal, you still need a colonoscopy to know for sure if there's a cancer there or not. So there's that level of anxiety with these non-invasive testing that's going to come because you have a test that's positive that suggests you might have a cancer. So then you have this window where you got to wait to get a colonoscopy because you can't just go the next day.
Yeah, especially if you're Black, I'm sorry, just go and get the colonoscopy. There's just way too many people. Like she said, he was diagnosed at 39. I mean, I've heard 35-year-olds with colon cancer. You really should just go on and get the colonoscopy because the one thing, like she said, the polyps are polyps is what would turn into a tumor, correct?
Yep, potentially. Yep. Every cancer started as a polyp. Not every polyp turns into a cancer.
Right.
But, we can't predict that. So
right. So if you can get the colonoscopy and if they see polyps, she can remove them right on the spot. Now, if it's too late, it's too late. And your Cologuard is not going to know that you had polyps that were sitting there waiting to maybe become cancer.
True.
It has no idea. So that's why it is a benefit to get the colonoscopy, because you could be potentially helping yourself from from clearing out your colon, and then you won't have to worry about cancer. I also told people it was the fastest 5 pounds I ever lost.
And you probably gained them right back, unfortunately.
I said it was lovely. I said, it wasn't bad. And you can also, and I will say your office was fabulous. They said, if you want a different prep, let us know, because of course insurance covered different preps, and my insurance did cover it, so it was fine. But I had the little, they were the little bottles that you drank, and it wasn't a big deal. It tasted awful, but it wasn't a big deal. Now my mom, I remember when I was a child, and I remember when she had that big jug and had to turn it, that liquid, that looked disgusting. And I was so grateful that that's not what I picked up from the drugstore, because I'm not sure I would have had to really convince myself to get through that. But these little bottles, it was not a big deal. I intermittent fast anyway, so it wasn't a big deal not to eat. But I did, I drank bone broth.
Oh, yeah.
I switched up between chicken and beef, and you couldn't tell me I wasn't having soup.
Right. Yeah.
That was fine. And then I think I did a little Jell-O, and it was not a big deal. I went, and it was done before I went to sleep and woke up, and it was like, oh, it's over. It was so
right.
fast.
Yeah. Well, yeah. Thank you for that testimony. There are lots of options for preps, and I'm flexible with people if they've heard good things about one in particular. Their friend took it, mother took, her sister, because the prep that they take and that you're encouraged to keep up with is the one that's going to work the best. So I don't want to force someone to use one if they think it's it's no good, or they heard so and so had problems with this one. So I'm glad you had a great experience, and thank you for that feedback.
Yes, and she told me I done it right. I was completely cleaned out because I remember they showed on Red Table Talk with Jada and her mom cheated. She was not completely cleaned out because she had eaten.
Oh boy.
So I was like, well, that wasn't the case with me. I was very happy, and maybe because I'm a doctor, but also I think that I do plan to live forever. Don't tell anyone. But I called the doctor and was like, I am 45. I need to know how do I get my colonoscopy?
Uh-huh. Uh-huh.
And they were like, well, you could go get Cologuard. No, 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 no. My insurance, I've already spoke to them. They will cover a colonoscopy. We will get this colonoscopy and get it out the way.
Mm-hmm.
And so they were like, okay. And they, set me up with you. And I was like, that works for me. Get it
Great.
done. I was like, it's done. I'm good for 10 years, you said? I was like, great.
Mm-hmm. Mm-hmm.
I'm good.
Good. Good. Good. Yeah.
And so I know the male population, unfortunately, our community is really, oh my God, you can't stick any, you'll be asleep. And you will have no idea what has happened to you. And you'll have no memory of it in the morning, as I said. And later when you wake up, you will not even know. It's just so quick and so easy. Not to mention the other thing I really liked was that you discussed the results right there on the spot. And I was like, this is amazing.
Yeah. It's a one-stop shop. I mean, if there's tissue samples taken that have to go to the lab, there's a
Right.
final report that comes. But yes, you can get your information. You can find out, do I have cancer today or not? And we can tell you right then and there if I
Yeah.
had to remove a polyp and when you need to come back. And yep, getting through that prep is the worst part for most people, but it's definitely doable. And if you get a clean bill, then you come back in 10 years. So
Yeah.
by then
So
you will have forgotten all about it.
exactly. So the the other thing that I'm always big to tell people, especially here at Black Doctor, we have discussed it at nauseum, but we can't talk about it enough. You need to know your family history.
Mhm.
Tell people why it's so important for colon cancer, why you need to know your family history.
Right. So a lot of colon cancers, folks don't have family history of it, but if you do, and there are some cancer syndromes that include colon cancer, stomach cancer, gynecologic cancers. So knowing, we're not big talkers, in our families. A lot of times there's a family member who had certain conditions and they may not realize themselves, or they may feel reluctant to share those details, especially when it comes to female trouble or
Mm-hmm.
colon or the prostate, organs that we think, that are kind of unmentionable. So it is important to know, because if you do have a family history, and if you have a mother or father or a sibling or your child who has had colon cancer, you have a substantially higher risk. And if you have let's say two cousins that were in their 40s who have colon cancer, you might be at a higher risk of developing colon cancer. So it is important to kind of to know those things, know those details, especially of these cancers where there is some hereditary, heredity to them.
And also for testing, for colonoscopy, don't they have to take their test earlier if they had a first line relative?
So yes, so if a family member is diagnosed with colon cancer, we generally will tell someone to start screening 10 years prior to that person's age at diagnosis. Let's say your mother was 45 when she was diagnosed with colon cancer. We tell you to start screening at age 35, because polyps start off as millimeters in size, 1-2 millimeters, and it could take up to 10 years for them to develop into a cancer. It usually will take them 2 to 3 years for them to be even large enough for me to see on an exam. And so that's where the 10 years comes from in the screening guidelines. But if and so if someone's diagnosed with a colon cancer, we figure they probably have had it up to 10 years. And so we use that window of time to advise other family members. And the highest risk of hereditary colon cancer we see are in individuals who are diagnosed under the age of 60. And so that number becomes very important. If you have a family member, your father again, or a sister or brother who was diagnosed in their 40s and 50s, then for sure, somewhere in that family, there's some genetics that are off, that are causing people to have colon cancer at an early age. Again, we're seeing younger and younger individuals come, with colon cancer. And the youngest patient that I've diagnosed was in her early 30s.
Yeah.
And I've seen younger. I've had colleagues who've diagnosed people younger. So it's not common, but unfortunately we do see it. And I do see even 19-year-olds who have precancerous polyps. So not a cancer, but had a polyp that definitely could have turned into a cancer.
So this is why it's so important that we know our family history, because you may need to start screening and you don't even know you're supposed to start screening. But knowing is half the battle, and early detection, I'm telling you, will get you every time. Now, colon cancer, I know people who end up with stage 1, stage 2 colon cancer, they end up living long, wonderful lives.
Mm-hmm. Absolutely. Absolutely. The earlier it's caught, the better. It can be easily treated. I've removed large polyps that have cancer cells in them that can be considered a cure. And then the next stage might be a surgical resection of a portion of the colon. And, and then if you have local spread, either to lymph nodes or maybe even possibly to your liver, then, you might have to add chemotherapy. But the earlier we can pick this up, the better. And the more people we can screen and pick up the polyps that can be easily removed, usually very easily removed.
Yeah. So, a lot of cancers, some of them you can't do anything about, and, but this is something that removal usually can put you in the clear. So really, it's so important to go to the doctor if you notice something, but even better, before you notice something, if you just get your routine exams that you're supposed to have, then you can catch it way before you'd ever notice any symptoms, which would make it a whole lot better for you. Right. So it's so important that we go to the doctor at least once a year, if not twice, but at least once a year, see a primary care physician and make sure that you're, up on all your screenings. If you, talk to them about what screenings do you need to have for whatever age you are. We actually did the State of Black Health a few weeks ago, and we talked about the different screenings for men and women at different stages. So 20s, 30s, 40s, 50s, 60s. And so there are different screenings depending on what age you are. But if you're just sitting at home waiting for something to happen before you go to the doctor, that's just not a good method of doing it.
No, absolutely. And at every age, you go, your parents, a lot of kids are taken to the pediatrician. Then we get to college and we kind of fall off the wagon for, several years. And we think when we're in our 20s and 30s, we're invincible, but you still need to do your check-ins at least every couple of years. And then or especially if you're having children, or a woman having children, seeing the gynecologist, getting, we could go in. You did this already, but the Pap smears and the mammography starts in your 30s, and so it's important to still stay connected to healthcare.
Yes, and unfortunately, in our community, so many of us end up dying when in other populations they don't die from the exact same thing, but it's because of the lack of access sometimes, but also the fact that we find out so much later.
Correct. And there may be, genetics, there may be cancers that are more aggressive in certain populations. I mean, certainly in subsets of every ethnic group, there will be a cancer that's aggressive. But when you look at the numbers, especially in colon cancer and prostate cancer, and the rates of deaths of Black men and women, they are higher than those of white men and women, and even in the Latino community. So, when you break it down that way, we tend to be, we tend to die more often from our cancers.
Yeah. So that's why it's so important. So important. We lost a very dear friend, and it totally was a misdiagnosis with colon cancer. And, but yeah, so I know that there was no reason that she had to die, but it was because of misdiagnosis, because she was on top of things. So you need to make sure that you go to the doctor. And if you need to switch doctors because this one is not listening to you because you've been having whatever symptom for so long, switch doctors. Right. Just like you would switch your hairdresser, or you would switch, the auto shop you take your car to, switch to a new doctor. Correct. Because you need to make certain that you and your doctor are working as a team, and you're the one living your life and that's your body. So if you're the one saying that this is what's happening, then they need to listen to you and figure out why is it happening.
Right. It's important to be heard. And if you're not being heard, getting the right reassurances and getting satisfaction and then yes, I recommend switching doctors. And that's probably one of the top reasons that people do switch, is that they don't feel heard. They felt that their symptoms were being blown off, and that they're not, their questions aren't being answered, to their satisfaction, and it's okay. It's okay.
Yeah, it's just perfectly fine. And there's so many options out there. Please just switch. Just switch. And that's the same thing we'll say about this prep for the colonoscopy prep. There is lots of options. I think that there probably wasn't that many options, 30, 40 years ago. No. But now there are. There's a whole lot of different things on the market. And, there's more than one way to, skin a duck or whatever they say?
Skin a cat. Skin a cat. I have a cat, yeah. But yeah, skin a cat.
So you don't have to do it this way. If this isn't going to work, then try, there's other ways. There's other methods out there. So please just talk to your doctor. Let them know for whatever reason this isn't working for you. But you want to make sure that you have the best results. So therefore, you want to make sure you do actually get your colon completely cleansed so that they can do what they need to do. Is there any last minute thing that you would like to tell our audience that help us to hopefully eradicate colon cancer from our community?
Well, unfortunately, it's a whole nother conversation to talk about access.
Right.
Colonoscopy, unfortunately, is an expensive procedure. But definitely get your checkups, talk to your primary care doctors. And the tools, we talked about a lot of the tools that you can use to get screened, but there are, stool tests that are relatively inexpensive that will get you to the next step. And, every major healthcare system has a mechanism for underinsured, individuals. We have, mechanisms in place in some of the facilities, definitely for sliding scale and things to definitely improve access. And, community clinics, will do screenings, and they'll do the stool, like I said, some of the basic stool tests that at least get you to that next level if you need it. And definitely if you have symptoms, seek out your care through your health systems, your primary care doctors. If you're a veteran, a VA system, there's definitely we're out here to try to get everybody cared for.
Thank you. And also, if your insurance, for whatever reason, tries to tell you that they won't cover it and you are 45, you can always appeal these things. Also, if you have to have it, as she said, if, say, your mother got it at 40 and you need to have your colonoscopy at 30 and your insurance is giving you a problem, that's another thing. You can always appeal that decision. You do not have to take that and just say, okay, never mind. No. You need to fight that decision, and your doctor will gladly put in writing why they prescribed you to have a colonoscopy at 30 years old. They will easily put that in writing for you so that you can present that to the insurance company, because it should, by every means, it should definitely be covered if that's the case in your family.
Yes, absolutely.
So, yeah. It's not fun working with insurance companies sometimes, but if that's what you have to do, that's what you have to do to make sure. Because like she said, it's not a cheap procedure, because think about it. The anesthesiologist has to come and put you to sleep, and, they have to keep you alive while you're there. And so it's not cheap, because there are more than one person's involved. But it is a necessary thing. So,
yeah. Absolutely.
Yeah. Thank you so much, everyone. We'll see you next time.